So we're moving on to our first pranayama practice, and this is known as breath awareness. And the aim is to make the student aware of the way that they're breathing at the moment, so we can identify any common errors and we can then build on that. And we've said so far that when we breathe, there are 3 sections to the typical method of breathing, so the typical breathing mechanics. One is that we want the diaphragm to be able to descend, and in order to do that, the abdominal area will just release and relax and become slightly bulbous. Secondly, we want the rib cage to be able to move sideways, and we do that because the rib is rotating, and if you look at the theory lesson, you'll see that that was called our bucket handle movement. The third type of breath that we have is where the breastbone lifts up, so the sternum lifts up, and again, if we revise that in our theory lesson, we can see that that is pump handle movement. So we've got tummy breathing, rib breathing, and sternal breathing. So we're going to practice becoming aware of that to start with. So I'm going to do it in a supported lying position. So I've got my bolster set up with a blanket to support my head. Bolster goes in the small of the back. Feet are apart so that my abdomen feels free. Lower myself onto the bolster so that my shoulder blades go each side. Arms away from the body so the ribs can move. Hands turned out. So just close your eyes and use your mind's eye to feel where the breath occurs. So firstly, as you breathe in and out, can you feel your tummy moving? If you can't feel it, just take one hand, place it on the tummy, see if you can feel your hand lifting and lowering. Lifting and lowering. Secondly, become aware of the movement of your ribs. Can you feel your ribs expanding and contracting? Expanding and contracting. If you find that difficult, use the backs of your fingers on the sides of your ribs. Expand and contract. Can you feel your ribs pushing against your fingers? And then finally, can you feel your breastbone lifting up and dropping back? Lifting up and dropping back. You can use your fingers and your breastbone just to monitor that movement. So we're becoming aware of the breath at the diaphragm, the rib cage, and the breastbone. Not trying to modify anything, just identifying whether those movements are occurring and becoming familiar with the fact that those movements exist. So that's our breath awareness in lying. And then we just come up, breathe normally for a while, and now let's do the same thing in sitting. So I've got my block to sit on. I'm sitting high on the block, positioning myself so that my shins are supported, lengthening my spine. And I'm growing tall backs of the hands on the knees. Now if you find that you're slouching forwards as you do that, it may be the sitting posture, it may just be the weight of your arms. So if you take a blanket, roll that up and then fold that across the waist. That'll give you something just to rest your hands on. So again, become aware of the three parts to the breath. Is your tummy moving? Breathing in, breathing out. Breathing in, breathing out. Can you feel the rib cage move? Breathing in, breathing out. Breathing in, breathing out. Can you feel the breastbone lift? Breathing in, breathing out. Breathing in, breathing out. Now let's practice without the cues, without the touching. Feel the breath in the tummy. Feel the breath in the rib cage. Feel the breath in the breastbone. So we're looking at movements throughout those whole three phases and just becoming aware that that movement is possible and aware that that movement either occurs or is stiff, and we would need to work on that. So that's our breath awareness in lying and then sitting.